Mike, as CEO and the administrator here at Logan Regional Hospital, you've probably experienced a lot of different things that I would love to talk to you about, but one thing is you want to see what the Valley, the community, thinks about the level of care here, and I understand you did an independent survey.
We did. We've conducted independent research in the community to determine where we stand, where the community thinks about the hospital, and overwhelmingly the community feels Logan Regional Hospital is their community hospital. It's their family's hospital.
I think that was probably a great thing to do as you became the CEO here and the administrator, to find out what the community was feeling. And, you know, I have to agree, growing up here and knowing the level of care that you've offered, and it's just that warm, fuzzy feeling of, you can help me, you can always take care of me.
Right. I mean, our goal is to serve the community, families, and take care of families and do the best that we can for the families. We're a nonprofit hospital. It doesn't mean we don't have to make money because we have a big facility and people to support. But our focus is on community service, and so there's a lot of things that we do to serve the community. First and foremost, we want to try to reduce the cost of health care in the community. And our emergency room does that to a large extent, in that we can keep more people here in the community and not have to send them out of town to get services.
Well, and that must mean then that your level of trauma center here is a high level, that you don't have to send me off to another facility.
It is. So the trauma center and the emergency room is a high level of trauma, but also we have the background of the additional services, and we are continuing to develop services to keep more people in the community.
Well, that's what we want, to keep our families close. I don't want to have to drive to Salt Lake or some other place to see when somebody's been hurt, so you can help keep our family members together.
Right, and I think the other thing that's important is the physicians that work here and the community, they're all community members as well. So they our goal is to take care of our community, because we're taking care of ourselves and our family. And so it's important that we continue to perpetuate that.
Absolutely. Well, I loved your #1 goal there of keeping healthcare costs lower, because that's killing all of us.
It is. I mean, healthcare costs continue to go up, and we're doing the best that we can to try to control them. And we're actually, nationally, we're a lot lower than the rest of the country, about 27% lower than the rest of the country, and about 20% lower than the rest of the state, actually. So
I've heard that through the news, that you're always applauded for that effort, so it's working.
It is, and you know, one of the nice things is that we don't have shareholders that we have to pay, so if any money that we have stays in, to make the facilities better.
Okay, very good. Tell me about your experiences then as being administrator and the overall care that you see that Logan Regional Hospital gives.
Well, I've really enjoyed being the administrator of the hospital. They're great people that work here and take care of our patients, and we feel a very strong community stewardship. The community trusts us when they come to the hospital, and we do all that we can not to betray that trust, and to do the best we can to providing great service for our patients, as well as great health care. And you know, the emergency room is really the front door to a lot of our services and a lot of our patients.
Well, earlier I had the opportunity to talk with Dr. Evans, one of the emergency care physicians, and him saying that he's local, he's right here, he's servicing the brothers, the sisters, the people that he knows in the community, and they're not coming from far away to help take care of.
Right, all of our physicians in the emergency room live here in the community. It's important because they see, when they take care of their patients, oftentimes it's their neighbors or the people they grew up with here in the community. And you know, my family comes to the hospital. My parents come to the hospital, and so it's very important to me to make sure we have the best care we can. Okay.
Now, aside from the emergency room, of course, the hospital is huge, and you offer so many different type services, and with the cancer treatment center, and there's just so many things going on right here at Logan Regional Hospital. Let's talk about some of the other things that you do.
Oh, there's a lot of things, the other things. You know, one of the things we're working on right now is a cardiology program. So we can do interventional cardiology here at the hospital. And that's going to be a huge gain for the community. So if you come into the emergency room with a heart attack, we will be able to treat you here for the most part. For most of those services, we'll be able to take care of them right here. And that's a huge thing, because there's a really important timeline from when you have a heart attack to get that blockage in your heart repaired. And we can do that quicker if we can keep the patients here. And so that's one of our new programs we're working on in the next year.
Well, and I've loved what you've done education-wise, opened up for the community to come and learn and understand certain issues.
Right. The Cancer Center has a cancer education center. Then we have a huge education here that has lots of opportunities and resources for the community. If they have any questions about anything with healthcare, they can come and do research, and we have a librarian that can help them pull articles and information to help them.
So we know that Logan Regional Hospital offers us the education, the services, the emergency care. We keep it together here in the community and in the family.
That's right. We're part of the family, part of the community family.
That is fantastic. Thanks so much, Mike.
You're welcome.